introductions. Start off with some introductions, and then we'll go into a panel discussion, which will be about 45 minutes or so. And then we want to leave plenty of time at the end for an audience Q&A. So at the bottom of the webinar, there is a Q&A function. Please use the Q&A function to ask any questions and not the chat function. I just want to make sure they're all in one place. Yeah, thanks for that. So without further ado, let's get into some introductions. I'll start off with myself. So I'm Carl. I'm head of marketplace here at Ben. And for those of you who don't know who Ben are, so Ben is a flexible employee benefits platform. We've been going about 5 years, and we're really trying to disrupt the space that we operate in by being truly global and truly flexible. So we currently support clients in over 130 countries around the world, and we host any benefit that any company wants to offer to their employees. So we're not restricted by workflows or integration processes. So we truly are global and truly are flexible. Be delighted to speak to any of you after, if you want more information about Ben. But as I said, we're also joined by a really super exciting panel today. We've got Pooley from Oliva, we've got Jason from Bluecrest, and we've got Wes from Muhdo. I'll come on to each of you individually. We'll start with you, Pooley. It'd be great if you could introduce yourself and tell us a little bit about Oliva.
Sure. Good morning. I'm Pooley, Head of Care at Oliva. Oliva, we're UK and Europe's #1 rated mental wellbeing platform. So we offer a combination of talking therapy and coaching to individuals. We offer care in over 36 languages. We also offer workshops and coaching of a professional type, so individuals can come and also work on very sort of career-focused problems, not just mental health problems. So that's us.
Great, thanks, Pooley. And Jason from Bluecrest. Jason's the screen that if you get a bit tripped out by the psychedelic colours, maybe enlarge Jason's screen for the duration of this call. Yeah, Jason, it'd be great to again hear from you and a bit about Bluecrest as well.
Thanks, Carl. I think that's the strangest introduction I've ever had, but I'll take one. Good morning, all. My name's Jason Morris. I'm head of intermediary and partners at Bluecrest Wellness. Bluecrest Wellness has been in the UK since 2012 and really came into the health assessment market looking to disrupt the traditional model of health assessments and make it much more affordable to all. The business has grown predominantly from selling direct to consumers to now partners, and also corporate clients, a significant part of our business with some a number of household names on our books, and really understanding the value of prevention before health issues become too serious or need more serious intervention.
Great, thanks, Jason. And then finally, last but not least, we've got Wes from Muhdo. So Wes, if you could again sort of introduce yourself and give us a brief introduction to Muhdo, that'd be wonderful.
Yes, of course. Cheers, Carl. Thanks very much for having me. My name's Wes Pooley. I am the Business Development Director and one of the co-founders of Muhdo Health. We are a preventative healthcare system using digital technology through web-based portals and apps, allowing basically home-based saliva testing to look at your genetic structure to help you understand how to prevent lots of different areas, but mainly around health and well-being. So your action interventions that you can use in your life that personalized to you to help you understand how to get the best out of your future. And we're a longevity company, so we're looking at how do we push the boundaries of longevity and slow down the rate of aging.
Amazing, thank you. So yeah, an expert panel, and really looking forward to the conversation today. So thanks for joining us, guys. So let's dive in. I think we'll start off with some sort of scene setting questions, I think, and yeah, to really sort of get the conversation flowing. So I think first of all, I think let's start by thinking about defining well-being, because I think often we get trapped in the conversation when we think about well-being, or when we think about health generally, we get trapped in the conversation around intervention. Everything we talk about in employee benefits is, more intervention based. It's things like medical insurance and those sorts of things. But really, well-being is driven by prevention, right? So what I'd be really interested to know from each of you is how your companies and how your how each of your companies supports well-being through prevention. If we could dig a little bit deeper into that, that would be really interesting, I think. So let's start with Jason this time.
Okay. I totally agree with you, Carl. I think the very simple part where Bluecrest plays in the journey is trying to stop people from getting ill, understanding what's going on inside of their bodies, and allowing people to take control of their own health. I think employee benefits, exactly as you say, is more about catching people when they're already ill. And we're kind of almost at completely the other end of the line in terms of trying to stop people from getting ill. Obviously, post-COVID, the pressures on the NHS continue to rise, and demand for the services, and very much what we're seeing is the focus on prevention and the level of understanding is increasing significantly.
Yeah, absolutely. And Polly, from a mental health aspect, I think I always get the impression that people only really seek mental health support when they reach a critical point of distress. And actually, mental health can be we can work towards mental health from a prevention standpoint as well, right?
Absolutely. I mean, I think that's a really understandable assumption that you make, given many services, the NHS, they have sort of gateways and thresholds that you have to sort of pass and be ill enough in order to get the help. At Oliva, we look at wellbeing across quite a holistic set of sort of pillars, recognizing that all of them, and if any one of them was sort of deficient, that could understandably really impact your well-being. So we look at social aspects of well-being, emotional, physical health, professional health, and also financial. So recognizing all of these things are really important. We don't have sort of thresholds in place. So we don't say like, oh, you're not allowed therapy with us because you're not ill enough, or you're not allowed this, you're not allowed that. People can come to us when they recognize something that they want to work on, and we'll support them, with that goal. And, whether that's therapy or coaching, we're there to support people when, whether they're sort of an earlier part of their journey, which is the opportune moment sort of to intervene before someone is so unwell that it's a real sort of hole to climb out of. So yeah, prevention and that early intervention is definitely better than the sort of crisis point.
Yeah. And whereas I guess prevention is at the heart of what you guys do, really, right? In terms of epigenetic testing and that side of things.
Yeah, absolutely. I mean, one of our sayings is prevention is better than a cure. So how can we help people with simple, basic interventions into their lifestyle that they can make changes themselves? And it links back into exactly what Jason and Polly have said there. It's what are the simple interventions people can make in their lifestyles? And again, they haven't got to be complex, haven't got to be complicated. They've just got to be building simple habits. The way I kind of always explain it is look at a 12-week plan and go, every week I'm going to change one thing for 12 weeks. I've made 12 changes rather than trying to change 12 things in week one and fail at pretty much all of them. So yeah, I mean, prevention is a massive part of things. And if you can understand that with genetics, we're talking about may have a predisposition to something. So it doesn't mean you're going to get ill. It just means the risk of it is higher than someone else's. So if you can understand that from the starting point, so we look at genetics as your blueprint to your body, it's easier then to make those changes and adaptability rather than going, I'm now ill. Now what do I do? Oh, it's too late because I'm on that pathway. And especially as Jason mentioned with the NHS, they're already overwhelmed as it is with everything going on. So if they can have a test earlier on, whether it be mental health, whether it be a health screening, whether it's genetics, whether it's bloods, there's so many different parts of the jigsaw puzzle that people can use to help them benefit them, because everyone has a different goal as well. And that's potentially why employees need to look at, what is my goal, what is my issue, and how can I overcome that? And there's lots of different parts, as I say, to the jigsaw puzzle that can enable that, whether it be mental health or, health screening or genetics.
Yeah, absolutely. Yeah. And I think, there's been some news recently around this, or maybe in the last 6 months or so, around a rise of ill health. So greater absence, just a rise generally of ill health. have you guys seen that? Are you guys seeing more people driven towards your services? And I suppose, what do you think the reason for that rise in ill health is? Is it a a remnant of the COVID era? Is it something else? And yeah, it's be really interested to know if you guys sort of share that view that we are seeing a rise of ill health within the UK population and more broadly as well, I guess. Polly, I don't know if you got any thoughts on that initially.
Yeah, it can be difficult to know sort of, is ill health rising or people presenting more to services because of, maybe stigma is reducing and there's more awareness there. But I think, looking at the climate we're in at the moment and the sort of pressures that people are under day to day and post-COVID world, I think there's definitely a lot more that people can struggle with. And yeah, day-to-day life for many people can be really challenging. So yeah, I think having an easily sort of accessible service is really important.
Yeah, absolutely. And Wes, you noticed much of is that something, do you guys track stats on those sorts of things, or do you not really monitor that?
Yeah, no, I mean, obviously, yeah, we look into the stats of it as well. Again, employee health and well-being is one of our pillars that we look into, and obviously we have some great relationships in those areas, and we're about trying to help everyone. As Jason said earlier, it's about making basically health and well-being or health screening more accessible for everyone. So keeping the price point low enough that everyone can get hold of it, because obviously, as Polly's just kind of alluded to there, the financial stresses of people and now have gone up with everything, all the, whether it's a mortgage, whether it's cars, whether it's insurance, food, everything's gone up. So, kind of health screening, I think due to COVID, has actually come to the forefront more, where people are now more intrigued in their health journey and want to understand things, because obviously if you do get ill or you do have issues, that costs more money. So if you can obviously look at it from the other way, and again, we work with a number of health insurers now, because they actually see the benefit behind it as well, because if you can stop people getting ill in the first place, they're not going to claim on their insurance and they're not going to cost them a lot of money. So yeah, there's different ways to look at it, I guess, and like you say, prevention is key to those areas. But the number has gone up, and it's, again, how do you want to look at illness? Do you want to look at MSK risk? Do you want to look at mental health? Do you want to look at illness out of just absenteeism at home due to a cold or a flu? So there's lots of different things that have done that. I do find, as a kind of a personal thing, that I've been delivering like education and health and well-being and those sorts of things for over 20 years, that people tend to put a lot of barriers in the way themselves. And it's trying to remove those barriers from themselves and actually start prioritizing what's important to themselves, because healthcare isn't that expensive, but they'd rather buy a top or go on a top holiday or, buy coffee every day or something. Do you know what I mean? I'm just kind of trying to give, simple examples of what people tend to do. Whereas, if they actually looked after their health and put things into place, it's not that expensive to do. It's not expensive to eat healthy if you understand kind of simple basic nutrition, which again is something that I'm sure Jason, Polly and myself are all trying to do as part of the businesses that we're in, is educate people, not in just kind of solely the area we're in, but as a holistic view, what other things can you do?
Yeah, no, perfect. And one final question I'll direct to you, Jason, before we get into the meat of each of your subjects, your sort of specialist subject areas. So we do see a lot. I mean, I see the NHS and other health systems now starting to talk more about, in the intervention space, treating the person, not the condition. So moving more into this personalised medicine space. And I guess from a health and well-being perspective, personalised data is incredibly important. To Wes's point there around actually understanding what your personalised health risks are. Actually having that data will help hopefully drive good decision making. So, I suppose the question is how important. The answer is very, I no doubt. But how important is that personalised data to the health and well-being journey, Jason?
Beyond very. I think the reality is we are all different, dealing with different things, with a different capacity to deal with that, or indeed genetics. To Wes's point, I think when you look around, the past few years have been very, very tricky for a lot of people. To Polly's point, I think awareness and stigma is changing. I think people are having to really look in the mirror a lot more at themselves, and love Wes's comment. You know, we sort of say people will go out and get their car serviced every year at more of a cost to actually get themselves serviced and looked after. So I think you know, providing robust testing, getting objective insights into what's going on inside people's bodies, and then more importantly, then actively monitoring what's going on. You know, people can make that decision, and certainly, you know, we're seeing that behavioural change, which again links into all of the other employee benefits and has an impact from a corporate perspective as to the output of potential claims in the future.
Yeah, I agree. Yeah. Excellent. Right. Well, I think that's enough of scene setting. Should we dive into the major sort of section of the conversation today? So we're going to start off with mental health insights. So Polly, we're going to focus the next few questions on you. So Jason and Wes, you can stand down and take a breath. So Polly, first question on mental health insights. In what ways can personalised mental health data improve the efficacy of therapy and counselling services provided to employees? Be really interested to understand that in a little bit more detail.
Sure. So thinking about when people initiate a journey sort of on their mental health, they're wanting to understand, you know, how we see the problem, how that might be diagnosed. Perhaps, you know, to some people a label isn't important, for other people it can be really validating and really helpful. From a sort of clinical standpoint, having an accurate diagnosis really enables you to then provide a targeted and evidence-based treatment intervention. So there is research out there that indicates certain problems respond better to certain types of mental health support and talking therapy, for example. So if we're able to provide that accurate diagnosis and those insights, you know, from the beginning, it then sets us up for success in terms of the journey to come, in terms of working on that problem and overcoming it. But I think it's also really important just to individuals to give them the information they often want in order to be able to educate themselves and sort of understand what it is that they're experiencing, do some reading around it and talk to others, hopefully, and hopefully sort of realize that actually there's probably many other people that whether it's they have that diagnosis or they know someone that does, or they've heard of that condition or problem before. I think all of that can be really validating as well in terms of, you know, overcoming your own mental health struggles.
Yeah, absolutely. And I think when it comes to mental health, I think we've come a long way, haven't we, in terms of bringing down some of those barriers and the stigmas. But there still feels they still exist, don't they? Right? These stigmas still exist. So is there a way that sort of personalized mental health data can help in reducing those stigmas associated with, you know, seeking help and support through, you know, in the workplace with regards to mental health?
I think so. I think that personalised data and having a sort of comprehensive way of measuring well-being provides everybody with a common language. Like if we can all complete a well-being profile and see how we're doing in those sort of 5 pillars that I mentioned, whether that's social, professional, financial, whatever, it gives us all I think a very day-to-day understanding of how we can break down and understand our well-being and see that it's not that we're crazy or losing the plot, or, you know, we've got something that's really sort of uncommon, but actually just struggling in one of these very kind of day-to-day pillars can, you know, contribute to us feeling, you know, not quite ourselves, and that I think really helps reduce the stigma, and it provides an opportunity to just sort of break down the problem that you're experiencing and see the kind of road ahead in terms of overcoming it. So yeah, I think you know, providing people with those insights and with a very common language and easy way of understanding their well-being just allows that conversation to start.
Yeah, and I guess if employers have this data available to them around, you know, so they've got mental health data insights, how can they use that to the best of their ability to support employees? I guess they'd want to support in a non-intrusive manner, right? They don't want to make a big song and dance about it, but they want to have the support there available to employees when they need it. And I guess so. How do they do that? What's your advice on that, Polly?
Firstly, really important to say that I think it's vital that all information is confidential. So, for example, what we provide to employers in terms of data is all sort of aggregated, and only when we've got sort of enough data for it not to be sort of attributed to any one individual. But providing companies with insights as to the kind of problems people are experiencing, whether it's burnout or anxiety or sleep problems, it allows the company then to run initiatives and to educate and support employees with those problems, and also sort of pause to question, why are we seeing a peak in burnout at the moment? Have people been taking their lunch breaks? Have they been working longer hours? Has there been sort of transparency around our values? And do people feel sort of safe and heard? So it just allows for that opportunity for employers to think, is there something we can be doing differently? Is there something that's been sort of contributing to this? But also running, targeted initiatives, partnering with companies like Oliva, where we can work with you to say, look, we can see this is happening. Let us run a series of workshops. Here's some information, some comms, some emails, some material that you can share with others. How are your managers bringing up these topics and their one-to-ones with people to equip them with the skills and tools that they need to support themselves? So I think all of that sort of information just provides ample and multiple opportunities to just support employees.
Yeah. I mean, I'm also a big fan of employee listening. So, we do this work with a lot of clients, helping them to survey employees or, conduct focus groups. Surveys better because you cover the whole, especially for this, what I'm talking about here, because you cover the whole population. But I think it's, I think when we survey employees, we too often just ask the questions of, what do you think of this? And what's your perception of this? We never ask, how are you? And I think asking how are you and understanding and building up a data source through that is really powerful as well. And I guess one follow-up question, so I always think that when companies put in amazing initiatives like Oliva, they often keep it as their best kept secret. It's almost like they don't the communication strategy to employees, and actually I think to people like line managers who are often the ones who spot the first signs of distress in people and who can signpost their employees to these types of services. It feels like we don't go far enough. I think is mental health first aiders, is that far enough to help? Is that far enough on this journey to help drive people into these solutions as they need it?
Yeah, I mean, mental health first aiders, they're not sort of experts. It's really good to show that sort of willingness and awareness, I think, within a company by sort of running that sort of initiative. But I think having an expert partner who can really do the heavy lifting is really important. And employers should look for partners that are going to shout about their services and drive engagement. We have specific people in roles that will kind of work with organizations if engagement is lower than they're hoping for, so that we can sort of drive that through the door. And that's exactly sort of what we want. But yeah, I think often benefits are underutilized. We're not aware of them, or we don't look for them until we're in that crisis moment. Whereas I think, like you said, having managers sort of bring them up, having things circulated or on your internal intranet or whatever to raise awareness is all going to really help that kind of awareness build up, so that people access it and hopefully get the help that they could benefit from.
Yeah, absolutely. Yeah. And housing all of your benefits in a single place, like Ben, is a great way to do that as well. So yeah. Jason, let's move over to you. Thanks, Polly. That was excellent. Thank you very much. Jason, so be really interested to know from a Bluecrest perspective and from your own experience, what are the most significant benefits you observed from regular health screenings? So companies that offer regular screenings to their employees, so benefits in terms of health outcomes, productivity outcomes. What's the client sort of experience been from really engaging in health screening?
So I think Probably two sides to that answer, if I'm honest, Carl. So I think from an employee point of view, we do a lot of research into the outcomes. We've seen 39% of our customers go on to lose weight, having had a health assessment, 36% exercising more, and 32% eating a healthier diet. So people really taking control of their own health. I think to Polly's point, it's about catching things before that crisis point, and I think that's ultimately where the value of health assessments is massively seen now. People understanding what's going on, and ultimately being able to live well. You know, with all of these other pressures and you know, mental health really comes into that. You know, being confident about your own health and feeling healthy, learning new habits, as Wes has said, you know, all is part of day-to-day life now, and needs to be kind of really recognised that you know, we do have to look after ourselves. You know, and without our health, we have absolutely nothing. So you know, I think that's from an employee point of view. I think from a company perspective, again, I think the dynamics of the employee benefits market really kind of have kind of shifted the past couple of years. Significant increases in PMI schemes, group life premiums also increasing, be that through you know, cancer as an example. 1 in 2 people in the UK will be diagnosed with cancer. That's an absolutely terrifying statistic. When I think back to when I first started in the market 30 years ago, that was 1 in 4. You know, that's a major shift, and that's before you even overlay so some of the other statistics. You know, 3.7 million people in the UK living with diabetes, and the under 40s have seen an increase of 39% over the past 6 years of under 40s being diagnosed with type 2 diabetes. So the awareness is massively increasing, and obviously from a corporate, from a company perspective, ensuring that your staff are being looked after, and more importantly, trying to stop some of these diseases and issues actually escalating. It really is key to get it on the front foot, and prevent some of these these things coming through.
Yeah, absolutely. And it's Men's Health Week this week, isn't it? And I was listening to TalkSport the other day, and they were doing a great job of talking about prostate cancer, and they were saying that 1 in 8 men will get prostate cancer, and 1 in 4 black men will get prostate cancer. And it's those sorts of numbers that are terrifying. You know, they're terrifying, but it should be a call to action, shouldn't it? We should be screening ourselves. We should be, you know, understanding you know, our risks and acting accordingly. So I think it really was a bit of an eye opener for me. I think I didn't realise. You hear the 1 in 2 stat, and you think, well, you know, cancer's still a disease of age, but which it is, but equally, you know, people are getting it younger, and you know, yeah, I think, and I guess that kind of comes on to another question I had really around screening. Like, a lot of screening in the past has always been, you know, perhaps it's been at exec level because of the risks associated and you know, the key person profile, etc. And then I guess, like, my kind of thought process around screening sort of changed to think, well, should it be more, you know, what are the values a 30-year-old or a 20-year-old can get from health screening? Is there value that a 20 and 30-year-old can get from health screening, or should health screening be targeted more towards the higher risk profile, shall we say, of age demographic? What are your views on that, Jason? I'd be interested to know.
I think that is a very interesting question, Carl. And I think to your first point, as I said, you know, Bluecrest is about reaching more people, and making health assessments more affordable to more people, and that's, I think, is absolutely imperative. I think when you look at the age profiles, probably in our 20s, we kind of think we're Superman or Superwoman. In our 30s, it kind of gets pushed to the back of far more important things, like, you know, potentially houses or children, and our 40s when things are starting to creak. it's you know, the thought process change, and actually when you get into your 50s, it's almost okay. Is it potentially too late? I think screening, and probably stepping on Wes's feet slightly, you know, if there's family history, absolutely, you know, testing and regular testing really should be taken out. I think it's first and foremost, it's about more people taking control of their own health and their own well-being, and ensuring that they are as fit as they could be or should be.
And screening doesn't have, I think, you know, again, perhaps some people have a vision of screening that there's the screening is one thing where you go and spend an hour strapped up to a VO2 max machine, and then screening is very different now, isn't it? You know, there's different levels of screening, different, you know, so there's something for everyone, I think, in the screening world, isn't there?
Absolutely, and Bluecrest kind of prides itself on almost removing the white coat syndrome, as they call it. So our screens take place in local hospitality venues. We have over 2,000 clinics held in over 400 venues, and also for companies, we can actually come on site, which again has proved very popular the past few months. Hybrid working obviously has had a lot of focus in the news about getting people back to the office, and companies actually using kind of screening days as an opportunity to promote the wellbeing program, and get people back into the office. But absolutely, it's about removing that mystery and taking control.
Yeah, excellent. And one final question for you, Jason. So the MI that comes out of the screening services to the employer, how have you seen companies use that to then help, you know, build out their sort of prevention, their network of support around some of those areas, if there's a propensity for certain things within health screening, or you've seen much of that?
Yeah, absolutely. So as with Polly, our results are anonymized up to, and we do it from a certain number of employees. I think it's for me, it's about joining the dots of what can come out from the MI and the data that the Bluecrest can provide. Does that then lead into overlap with occupational health? Does that potentially lead into the medical insurance side of things? So I think it can highlight some key areas which we see businesses take on board and amend what they're doing to ensure that they're accommodating it. We also see the flip of it. Recently had a meeting with a potential client that on their medical insurance scheme actually had a cancer claim for £1.2 million. They understood the importance of screening and prevention, and it was just one of those of, if only the screening had taken place, that £1.2 million claim on your medical insurance scheme actually could have been halved, quartered, or even more so. So for me, it's kind of building the whole journey of employee benefits, as prevention is the bit that kind of sometimes is massively overlooked, and that drives so many other behaviours down the line.
Yeah, absolutely. Perfect. Thanks, Jason. Wes, you're up. So let's learn a little bit more about epigenetic testing, shall we? So I mean, I'm like I am with Oliva and Bluecrest. I'm a huge fan of Muhdo and what you guys do. I think it's incredible and very timely, I think. Can you give us a bit more information and understanding for those that aren't sure what unique insights epigenetic testing provides that perhaps traditional health assessments don't? And then also, I guess, follow-on question, how those insights can be utilized by the individual to enhance their own well-being.
Yeah, of course. If I do a kind of genetic 101 to start with, that's probably the easiest way of doing it, because obviously epigenetics links to DNA testing as well. So so the DNA, you're born and you die with the same DNA, so that you basically can do one test and it can tell you a plethora of different information, and that's what we call your blueprint to your body. And can, just with a simple DNA test, you can get a lot of information that enables you to make, as we were already saying, preventative lifestyle changes through simple actionable interventions. So it makes it very simple to do and use. Epigenetics, the better known term is called biological age. The reason behind it is looking at your internal age. So how does your body change over time linked to your lifestyle and your environment? So genetically, if you think of your body as like a dimmer switch, your genes as dimmer switches, they can be turned up and turned down depending on your genetic makeup. Depends on whether you want to turn them up or you want to turn them down to basically get the best out of it, and obviously to hopefully prevent things ever happening. Like I said earlier, it's all about predispositions to issues that lead you on later. As I again spoke about earlier, is genetics is part of a jigsaw puzzle. There, as Jason and Polly, have within their own companies, there are different reasons people do different sorts of testing. So again, depending on your goal would depend on potentially where you may start or where you may go to start with. And then it may push you down a different avenue and route. And obviously from a genetic standpoint, sometimes that helps you make a decision of, okay, I need to go and have a blood test, or I have a gut health issue, I need to go and have a stool sample, or I have a mental health issue, I need to go and look at, that in a different way. So there's different ways to look at the different routes to it. And with the epigenetics, as we're talking about, it's a biological age testing. So we're looking at your chronological age against your biological age and what's the difference. And the aim is to try and get your biological age younger or the same as your chronological age, because we're talking about the rate of aging and can we slow that down? So can we live our life in our 50s, like in our 70s, like we did in our 50s? So can we be healthier for longer? We're not looking to improve or expand life expectancy. We're looking at living healthier for longer by making simple interventions into your life. So epigenetics is just a really simple way of doing that, because it's all done through your home. You can do it at home. It's a saliva test. It's very invasive, and it's simple and basic to do. And then the information you're given, that we give, is backed by science. So there's 5 peer-reviewed medical white papers on every single outcome we have. And from a DNA standpoint, there's over 300 different outcomes that we have, linking from vitamins, minerals, gut health, heart health, skin health, muscle health, nutrition, and the list goes on and on. So there's lots of different things that can help. And the key to look at when you look at genetics, it's polygenetic. So we look at how they all interlink into different areas. You don't just have one outcome that affects one area. That outcome could affect a number of different areas, which therefore affect different lifestyles, which there also may lead you back to doing different health screenings because of that, because of those markers. Obviously for an employee, it's obviously useful to know this information about yourself. It's a test all about you. You can't Google your genetics. You literally get that information from doing a test. And then from that information, our application that we have for the employees, they can use to understand themselves better. There's simple actual interventions that they can follow. There's summaries of ideas of things they can do, and different aspects. And again, you can go back and link with other people. We work with, over 500 different partners who all offer support to employees, whether it's an occupational health company, whether it's a nutritionist, whether it's a lifestyle specialist, whether it's a mental health specialist, whether it's a health screening company. We work with lots of different people because it as I say, it's part of that jigsaw puzzle, and it adds value to what general health screening has. Obviously, my opinion of some of the health screening is it's very basic and it doesn't deliver anything towards the goal in which the person's actually trying to achieve. I always go back to BMI because I'm an ex-international professional rugby player. When I do my BMI, I'm clinically obese. So for me, BMI isn't a best measure of whether you're healthy or not, because I have genetically obesity risk and a type 2 diabetes risk, but I don't have any of those effects because I've lived my lifestyle in the correct way, healthy. I take the right vitamins and minerals. I eat properly. I sleep correctly, etc., etc. So it's just knowing those simple, basic things that you can do prior to that. Back to the original point of, actually, even though I was an elite athlete and people will go, well, you're healthy anyway, elite athletes are not healthy people. When we look at normal people, elite athletes are not healthy because they're highly stressed. They're doing things to their body that they potentially shouldn't be doing. So you don't need to train like an elite athlete, go to the gym 5 times a week, have to eat this really strict diet of chicken, rice and broccoli that people say to be healthy. When I did my original test, I was actually the most unhealthiest person in our office, even though I was the youngest, the fittest. I was going to say the best looking, but probably one of the guys there would probably disagree with me there. But so again, you kind of get that implication that it's not necessarily you have to do lots to be healthier. There's just some really simple things that, you know, you could do. Sometimes you have a high sensitivity to caffeine. So if you reduce the amount of caffeine you drink, that's going to have a benefit to you. It's not saying you have to cut it out completely. You know, same with, you know, carbohydrates and sugars. You don't need to cut them out completely, but potentially they are dangerous towards certain things and certain areas, especially things like Jason brought up, obesity and type 2 diabetes. So, you know, there's different areas to look at. I'll stop talking on that point, otherwise I'll probably go completely off on a tangent, which I've probably slightly done already.
That's great. No, thanks, Wes. And I think that's one of the important things for me, I think, around what you guys do is the call to action there as well. So it's a case of, you know, you help them understand where the problem areas are and where they can and how they fix them ultimately. So it's a call to action, and then how do they address that? So I think that so what piece is often missing, isn't it? It's like the data's there, but then there's no call to action, or there's no guidance on how to you know, to power through that, you know, and change that particular aspect of whatever it is. So I think that's really, really important. And I guess sort of follow-up question, Wes. So what's the future of this? You know, what's the innovation around epigenetic testing? What's next? What's the what's the future of this? I suppose in terms of supporting health and wellbeing programs, but also like, you know, these things move along at a rapid rate, right, in terms of what we can do. So you got any insights there as well? I'm sure that the audience would love to hear any sort of any insights as to what's next.
Yeah, of course. I mean, it kind of goes back to kind of what we all do, and obviously looking at how do we keep people engaged, how do we retain people on their health journey for longer, because the tendency of the original health screen, you know, like Jason was saying before, you know, Bluecrest came in and started changing things, was you'd have a health test and you wouldn't see someone for another year. Whereas now that, whether it's mental health or whether it's, you know, health screening, you now have a lot more, and especially with Muhdo, we have interventions on a monthly basis. So every month we have a release of what we call a health mode that basically keeps the client, the employee engaged in their health journey to either go, oh, I need to go back and do this, or I need to go and see that person, or I need to do a different health test, or I know I have a deficiency in vitamin B12. I normally have vitamin B12 injections. I better go back and have that looked at, etc., etc. So it allows that kind of process moving forward. For us, from an epigenetic standpoint, the changes we're looking at bringing in what we call onset clocks. The reason behind that is the biological age is an overarching metric. So we always say, if you can't measure it, how can you improve it? So the biological age is really key because it gives you a metric you can use at the start, the middle, and the end, and you can continually test it depending on where you are on your biological age. If you're quite high above it, you may want to do it every 3 months because you're putting interventions into place to make those changes. However, if you're, you know, around your biological age or younger, you might do it every 6 months to 12 months. And that's the trend that we use with most employers that we work with. It's normally a 6 months to a 12-month process, because it allows people to actually take time to make those changes, and that's what epigenetics is. It you know, there are markers in the body that change instantaneously, but we're looking at the overarching, the biological age that takes time to change. So we normally say, that's why I was using the 12-week. At 12 weeks, you'll see normal change taking place. And normally people who do kind of health journeys are normally on a 12-week pathway. And at those 12 weeks, you'll then reinvestigate that area and say, has it improved? Retest, do a different test, manipulate those tests in the way moving forward. And again, from a epigenetic standpoint, looking at age of onset is breaking down the biological age into specific areas of the body, more so that potentially your biological age may be high, but it's not because your nutrition's off or you're not taking vitamins and minerals. It might be due to, you know, an illness. It may be due to stress. It may be due to something else that's actually causing that. And to be able to then identify that specific area means it's a lot easier then to make those changes, rather than kind of going, well, I'm doing all these things, why am I still doing that? And something like a family bereavement, for example, or being highly stressed at work will affect your biological age. So understanding that those simple things could have those implementations and impacts on your body are really key to know. Obviously, from an employer perspective, we offer, like Polly brought up earlier, and Jason mentioned as well, we offer, you know, management insights into aggregated and normalized data. And as Polly said, you have to wait till you get a certain number of people before you would allow that information to go out. but we can provide information based off things like questionnaire, your genetics, lifestyle data, because we collect through our mobile app lifestyle data that allow us to basically help and support people better. The more information you give us, the easier it is to help. And to one of your points, I think it may have been Jason that answered it earlier about personal data. What people need to realize is the data is theirs. They own the data. No one else owns their data. They should never give or sign their data over to anyone for no reason. They control their data. So all their data is theirs. It's not their employers. And we obviously then be able, with that information, to be able to go, look, these are some of the areas where people in your company are having potential issues. For example, in like manual labor, MSK risk is higher than people who sit at desks. So obviously that's an area where people will be off work, which means they're obviously not in work. They're claiming on insurance. Obviously the work's not getting done, etc., etc. And then there's that knock-on effect of stress, anxiety, because you're going back to work and actually your workload's gone up because no one's picking up your job while you're away. So yeah, there's lots of different things that could help employers and employees with health insights moving forward.
Excellent. Appreciate that, Wes. Yeah, I mean, so just to finish off this sort of section of the conversation before we move into the Q&As, I've been doing this for 20 years now, advising companies on how to structure these their benefits in multiple areas with multiple through multiple lenses. And I think the one thing that's always been front of my mind is utilizing lots of different companies and experiences through your support network, through in building out these strategies. So I don't think there's one provider that provides all solutions out there, right? So I think companies should be working with the likes of Oliva and Bluecrest and Muhdo in combination to provide support to their employees. So I would encourage you guys, anyone listening. I say anyone listening, like there might not be anyone listening. I'm sure that people are listening. To reach out to the guys if you've got an interest, because I think a holistic approach to health and well-being, across the experience and the amazing businesses that these guys have created and work with, then is the right approach. So let's move into some Q&As and find out what the audience would like to know. So I said I'd pick the difficult ones, didn't I? So I'm gonna honour that. Actually, no, they're all quite nice. So I've got a question here for you, Wes, just quickly. So how reliable is genetic testing?
Yeah, I mean, obviously any testing nowadays is blood testing and genetics. There's no difference. They're done in the same labs in the same environment. So we use a company called Durafins as our lab provider. They're the largest genetic profiling company globally. They have 850 labs globally. So they're very well reliable and valid. There's hundreds of thousands of scientific papers now backed on genetics. It's been around over 70 years. Obviously, epigenetics is a little bit newer. It's been around probably 25 years now. So there's the data out there, and like I say, everything we do is backed by science. If we do lots of research in the background, so we can obviously improve the areas we deliver to people, and obviously give more insights into people and specific areas that basically we know from the research that we've done over 50,000 samples over the 7 years we've been in business that enable us to look at what are the trends within people's genetics, and it's global, and what basically have helped people make those changes. And then obviously we add new modes, new areas, we improve our algorithms, and we bring out new areas within epigenetics, because obviously times are changing, lifestyles are changing. So yeah, the data's now there to support the testing's very reliable, valid and useful, and it's personalized against you. We get people that come back and go, this is me, because it's telling me I have this and this, and your genetics is telling me the same. So we know, from our reporting that we cover a lot of, valid and reliable information that then people can then make change. And we have lots of case studies, whether it's in the corporate world or whether it's in the medical world, of really positive outcomes from people understanding things. And we've slightly moved into the area of disease testing that's also looking at prevention, predispositions, because obviously they're key in kind of the movement moving forward.
Cool, great, thank you. Holly, question for you. So you mentioned using a common language when it comes to discussing mental health. This person was just wondering if you could explain that a bit more. What do you mean by using a common language?
Very fair question. What do I mean by that? I mean, I guess we're all quite used to not really talking about ourselves. Like when someone asks how are you, and we just say we're fine, or at best maybe we say we're not great. But I think it's just recognizing that actually if we can be quite open or just straight with how we're feeling, that really firstly sort of role models, I think, a sense of psychological safety to others in terms of also sharing how they're feeling. But it also removes that kind of cloud of uncertainty as to what is going on for somebody, or what does that mean, or what's that about. So for example, I think sharing things like if we're feeling down, saying we're feeling down or worried or anxious, or we've been struggling with sleep. I think just being really aware of the language we are using, and trying to be concrete with that, also works to sort of remove the stigma of mental health. So, I think we can all relate to feeling down now and again, or having sleepless nights, or being up worrying, and I think that they're very normal things. So the more we can sort of normalize and speak about those very human experiences that relate to our well-being and mental health, the more it sort of contributes to removing that stigma, and I think that then helps people feel able to get the support they need, and to draw upon their network and colleagues and friends in terms of sharing what they're experiencing. So yeah. I hope that helps.
Yeah, no, it's a great answer. And I think I know it's a bit of an old one, but I like I do like the phrase that it's okay to not be okay. And I think sometimes people feel as though that's not the case, and I think we just need to create a safe place, don't we, where people can be their authentic selves, I guess, in terms of whether they're struggling or not. Well, you've got your hand up. Is there something you want to add to that, or?
Yeah, sorry. Yeah, I just wanted to obviously add on to what Polly was saying there, and totally agree with it. And I think in some ways is we use data as kind of a way of looking at things. The problem is if you've got a massive amount of data and don't know how to then use that data and use that information, because the language isn't the correct language to the end customer or client or patient, however you want to describe them, then there's no use to it at all. So it's making the information that you then display back to the end consumer in a way that is easy. And I say, this is how I interpret it, Polly, was the common language was how do people understand the information? Because people get scared of, whether it's testing and worried about the outcome, but then they don't understand it, which scares them, rather than going, okay, well, you've got this is the issue, but if you do these 3 simple steps and it's simple to understand, then they're able to make those changes. So I just wanted to add that to what to Polly's point.
Yeah, and I think data and information being palatable to the end user is super, super important, I think. And that's one thing that we focus on in Ben, is that actually benefits are complex to people that don't understand them. If you try and and if you give people choice, I firmly believe you have an obligation to educate, and in order to educate, you need to make these things palatable. So couldn't agree more there. Jason, question for you. So you've said that you can share MI data with existing clients, but do you also have data or case studies that you can share with potential clients that can help HR teams to secure budget and show the gain is worth the investment?
Absolutely, yeah. So if you'd like to contact Carl, happy to set up a meeting and talk through what's available and where we see the positioning of the assessment. So yeah, we would be happy to have that conversation in more detail.
Yeah, so this person's anonymous. So, but yeah, please reach out to us, and we'll connect you with Jason and make sure you get the right support there. Excellent. Okay. Another question here. So, health screenings again for you, Jason. So, health screenings for companies outside of the UK, so in European countries, is that something Bluecrest support with, or do you partner with anyone around that?
Unfortunately, not. But again, we probably one we can take away and see if we could find some support. That's not an issue.
Yeah, I mean, if not, then we certainly at Ben we work with health screening providers in Europe as well. But yeah, excellent. Let's have a look at. I should have moved these to answered. Otherwise, I'm now trying to realise which ones I've picked up and not. let's have a look. So where's another one for you? So how would you tackle the argument that the number of health risks a person could be subject to are anxiety inducing and potentially damaging to the mental health of those that worry about their future physical health? Does that make sense?
Yeah, I mean, potentially Polly's probably got a better answer for me than for that than I have, due to the fact that obviously she deals with obviously the mental health side of aspect of it. Again, the genetic testing is going to actually look at mental health areas. So, stress does, stress affect the gut? Can anxiety affect, a different area of the body? We normally find kind of you have things like anxiety affects decision making, brain fog, mental clarity, all those things. So if you can obviously understand that you have those risks, then, working with Polly's company, Oliva, is going to help you to manage those risks over time, but then potentially support physical risks as well moving forward. As I say, I agree that you can believe something is actually making you physically not perform, if that makes sense, because if you look at it from I use a sporting because that's my kind of background, but from a sporting aspect, if I'm highly anxious or I'm struggling mentally, my performance on the pitch is not going to be as good because potentially something affected me, even something from a home life. So say I've had an argument with my partner, or there's I've had some bad news, or work's not going very well, or whatever it is, that will have an impact on my physical health on the pitch. There's certain things you can obviously not do it. There's nothing you can do about it if you get hit with that before you're literally going on the pitch, or before you're going into a meeting. If we put it in the corporate world, potentially there's not a massive amount you can do about it if you're hit with it at that moment in time. If you're given time with everything, you'll be able to put interventions into place to know this is how I manage this. We use mental imagery and different methods to help overcome those stresses, and put into place pathways to enable me to deal with those stresses when I'm on the pitch, or when I'm in work and in meetings. But I believe Polly's probably got some answers for that.
Yeah, Polly. Before we go to you, Polly, I think just to clarify that point, I think because I think James has now given. I think it was James who asked the original question, has given some clarity to that. So I think there's the point was around understanding sort of health risks, or understanding your propensity to something might then create anxiety and induce anxiety that therefore. So I guess which I don't believe is a reason to not do it, obviously, because it's better. We need to understand health risks. I'm sure James agrees with that. But then I guess, Polly, to your point, into your world, supporting people through those times of struggle in relation to physical health is probably a huge part of what you guys do as well, right? That's probably what you were going to say, I imagine.
I wanted to share actually how as humans we struggle quite a lot with uncertainty, and I appreciate that the testing doesn't give absolute certainty in terms of you're going to have this particular condition, but for many people it's the not knowing whether there are any predispositions or any what can they do, because there's probably an endless list of things you should be doing if you don't have any information to sort of guide you in the right direction. So I think giving people the information, a bit of information to sort of guide their actions can be really helpful. And there's also a really important point, I think, around also the support that is provided around the data. And if you do have results that indicate that, say, there is quite a high likelihood of, say, a serious illness, then getting support around that would also be really important. And I think, genetic counselling is something that exists, and, it's important for people. But yeah, I mean, I've worked with people with health anxiety, and they might worry about and become really fixated on a particular condition. And I've seen it before, and then they actually get ill with something else, and suddenly they're like, well, now I'm just not worried about anything, because, I can't predict these things entirely, and actually often when we are presented with a reality of a situation, we're able to cope with it, but it's more the sort of uncertainty that is much more difficult. So that reality of information and giving us a steer sort of in the right direction is going to be more helpful for most people, I think, than just being in total darkness.
Yeah, absolutely. I'm really sorry, guys. We're gonna have to end it there. We have to be respectful of everyone's diaries. We've gone slightly past time. So thanks everyone that's dialed in to join today. We'll get to the questions we haven't answered after the webinar. Huge, massive thanks to Polly, Wes, and Jason. Really, insightful conversation, and can't thank you enough for joining us today. Yeah, I hope everyone listening and the rest of the panel have enjoy the rest of your Thursday. So take care. We'll see you soon.
Bye bye.